Finger sucking and pacifiers. Many babies outgrow it well before their first birthday, and most stop by age of 5 due to peer pressure. However, it may become worrisome when the permanent teeth start coming in, around the age of 5, if the sucking alters the shape of the child's teeth, palate or bite. Try to get rid of the pacifier before 4 years of age. If going cold turkey is too hard, have your child leave the pacifier in the bedroom every morning so that they can only use it at bedtime or nap time. Head banging, head rolling, and body rocking. The habit usually begins around the age of 9 months and resolves around the age of 2. Body rocking is when a child rhythmically rocks while either sitting or resting on their knees or elbows. Most children rock for 15 minutes or less. Head banging, head rolling and body rocking are common childhood self-comforting habits. Teeth grinding. It usually starts around the age of 6 months when the baby teeth come in, and again around the age of 5 when the permanent teeth come in. It can be concerning when adult teeth are in, as it can cause dental problems or a disorder of the jaw joint. Nail and cuticle biting or picking. Like other habits, positive reinforcement strategies are the most effective way to stop the behavior. Try to catch your child without their finger in their mouth, and simply describe what they are doing with their hands instead. Nose picking. Nose picking is one of the most aggravating behaviors to parents because it is one of the least socially acceptable. Nose picking can start when crusting occurs from infection, allergies, or minor trauma. Tell your child that picking their nose is not acceptable in public, but that they may use a tissue to clear out the nose and take care of itchiness. Insist that they wash their hands after they pick or blow their nose. Keeping the nose moist with a little saline spray before bed can also help. Talk to your child's primary care provider to find out what they recommend to reduce your child's nose irritation. Hair twirling, hair pulling. Hair loss may be a sign of medical problems such as infection or other disease. On the other hand, hair twirling or mild hair pulling that results in minimal hair loss is just another self-calming behavior seen in infants and children. Tics. Tics are stereotyped behaviors, twitches or movements, that are frequently repeated. The movement can involve any body part. A facial tic, especially blinking the eyes, is the most common. The child is able to suppress the tic voluntarily for minutes to hours when acts. If the tic occurs for longer than 1 year or the child cannot suppress it, it may be a sign of a more serious problem and needs evaluation by your child's doctor. Masturbation. It is important to remember that at this age, masturbation is not sexual to the child. Breath holding. A breath-holding spell is an episode where the child stops breathing for a short period of time after an upsetting, frightening or painful experience. The spells usually happen most often around 18 to 24 months and stop by the age of 5. It is also important to know that the episodes are not voluntary. When a breath-holding spell occurs, keep the child calm and protect them from injury. How can I break my child's bad habit? First, try ignoring the annoying behavior. Your child will probably outgrow the habit with time. Giving a lot of attention, even though it's negative, may actually encourage the behavior. The best kind of praise simply describes what you see that you'd like to see more of. When she gets a little older, though, she may be interested in having nice-looking nails. If there are several behaviors you want to change, start by focusing on 1 or 2 of the most bothersome or dangerous ones. For example, if their nose is irritated, have them clean it with a tissue, apply saline nasal spray or petroleum jelly, consult your pediatrician for their recommendation, and then wash their hands. Additional resources